Assalamu alaikum. Formation of abnormal blood clot of few millimeter diameter can cause life-threatening conditions like cerebral stroke or myocardial infarction or deep venous thrombosis anywhere inside the body. However, this does not occur because our bodies are protected by natural anti-coagulation mechanisms, so we can live safely for many decades without abnormal formation of blood clot. This is important topic, which is natural anticoagulation mechanisms or causes of fluidity of the blood. Clots can't be formed under normal condition. Clots can be formed without a reasonable cause, whether injury or damage of the vascular system, because of too many defense mechanisms that are present inside our body. These factors can be divided into endothelial factors and blood factors. We start first with the endothelial factors. Our endothelium is so smooth, and this smoothness is so essential because it prevents platelet adhesion and activation of the intrinsic clotting mechanism. Moreover, our endothelium carries glycocalyx. Glycocalyx is a type of extrinsic proteins that repel with platelets and the components of clotting system. Moreover, there is a magnet for thrombin that is called thrombodulin that is fixed over the endothelial cell. Appearance of any abnormal molecules of thrombin will be inactivated by this thrombodulin. So we have these three important protective factors: the smoothness that prevents platelet adhesion and the activation of intrinsic mechanism, the presence of glycocalyx that repels with platelets and clotting factors, and the presence of thrombodulin which inactivates thrombin if present. However, if our endothelium is damaged or undergo roughness due to chronic diseases like diabetes, hypertension, or any cardiovascular problem, this may cause activation of the intrinsic clotting mechanism because of loss of smoothness, loss of glycocalyx, and loss of thrombodulin. These types of patients must take prophylactic treatment for thrombus formation like antiplatelet drugs and anticoagulant to replace the lost natural mechanism. Second, blood factors. We have too many blood mechanisms that protect against blood coagulation. First, absorption of 90% of thrombin to the surface of a clot. Thrombin is an enzyme and it is not consumed during reactions, so it can travel along the blood and cause extensive clots. However, this does not occur because 90% of thrombin is inactivated on the surface of the clot. It is immobilized. It is absorbed on the surface of the clot. The remaining 10% which can escape to blood, it finds too many antagonizing factors of this antithrombin 3, which binds and antagonize the escaped molecules of thrombin. The third mechanism is heparin, and heparin is a naturally released substance from our mast cells and basophils, and it is important activator for antithrombin 3. The fourth important mechanism is the presence of fibrinolytic system or plasmin system. Heparin is a natural substance that is released from our mast cell and basophils, and it can be sensitized, and it is used successfully as a therapy for thrombotic disorders. The naturally released heparin works as a cofactor for antithrombin 3. It raises its efficiency up to 1000 times. Moreover, it forms with zeta complex that inactivate factors 9, 10, 11, 12. So heparin is so efficient in prevention of blood coagulation. The fourth mechanism that is present in the blood and efficiently prevents clot formation is fibrinolytic system or plasmin system. Understanding the principle of plasmin system is so essential because it has many clinical applications. So what is fibrinolytic system or fibrinolysis? Fibrinolysis is a natural process that breaks down blood clots after it has done its duty. It is a process of lysis and the breakdown of blood clot after it has been not needed. When the blood clot is formed, it protects the process of healing for many days. After end of these days, the remaining parts of the clot are destroyed or undergo a process of lysis or fibrinolysis by this system, which is called fibrinolytic system. To remind you, we said in the process of hemostasis, the first response from our body is vascular spasm, the second is blood formation, the third is clot formation, and the fourth is fibrosis to the part in the vascular wall. However, the parts that is present inside and outside, they are not needed. They achieved their duty, so they undergo a process called fibrinolysis. The steps of fibrinolysis or fibrin degradation are as follows. First, formation of plasminogen activator. The formed plasminogen activator converts plasminogen into plasmin. Then plasmin breaks down the fibrin clot into small fragments. Plasminogen is a type of plasma protein that is present in blood and anywhere inside our body, but in the inactive form. To simplify, the system converts fibrin into fibrin degradation products, small pieces which are engulfed by microphage and macrophage. This process needs the active substance plasmin that is naturally present inside our blood in the form of plasminogen. So we have too much plasminogen, but the process can't occur except in presence of plasminogen activator. If this factor is present, the cascade starts. So the steps will be: first, formation of plasminogen activator. Second, conversion of plasminogen into plasmin. Third, degradation of fibrin into fibrin degradation products. So the main question here is, how can plasminogen activator be formed? We have many mechanisms that cause formation of plasminogen activator. The first is a tissue factor called tissue plasminogen activator. The second is enzyme called urokinase. The third is streptokinase, a famous substance that is derived from the bacteria Streptococcus. First, the tissue plasminogen activator. Very important substance. How it is formed and how it works. As we said, in the fourth step of hemostasis, which involve fibrosis for the part within the wall and fibrinolysis for the remaining parts. The blood clot remain for many days, in average from 6 to 8 days. Within these days, the tissues slowly release tissue plasminogen activator. As I said, slowly, within days, to give time for the blood clot to achieve its duty in stoppage of bleeding and in protection of the process of healing. After passage of many days, TPA is released from the injured tissues. It converts plasminogen, which is present everywhere inside our body, into plasmin. Plasmin later come to degrade, to break down the blood clot, causing its lysis. This is the simple mechanism. So the steps are the release of TPA slowly from the tissue, then conversion of plasminogen into plasmin, later formation of fibrin degradation products from fibrin. Now TPA is prepared by genetic engineering and it is used extensively for treatment of thromboembolic disorders, whether in the cardiovascular system or in the nervous system. So what is the significance of fibrinolysis? First, the fibrinolytic system is present naturally inside our body and it reopens the vessels after stoppage of bleeding. Whenever there is a vascular injury, blood clot is formed and the blood vessels in the surrounding area are clogged. After achieving its duty, the vessels reopen again by the fibrinolytic system. Second, the fibrinolytic system is important for prevention of formation of clots within the urinary tract. Also, it prevents clotting of the menstrual blood. The fourth use, also fibrinolytic system can be applied successfully in treating patients with thromboembolic disorders, whether in the brain or in the cardiovascular system or anywhere inside our body. But this needs to be done within few hours. Unfortunately, if the process is delayed, it may be useless. Finally, I thank you very much and see you in next lectures.